Also, the nightmare at nursing homes, severe staffing and equipment shortages, families not even told when their loved one has died. The growing concerns over where your food comes from. Over 600 meatpacking workers in South Dakota now testing positive. A growing number of plants shutting down. Will it cause shortages at the store? And
this is NBC Connecticut News.
COVID-19 testing is now expanding quickly in New Haven. A third new walk-up site will open on Monday, and that will improve access to testing, especially in communities of color in New Haven. And it's part of a plan Mayor Justin Elicker discussed for several weeks now. NBC Connecticut's Kyle Jones has a look at how this will help.
Some say the church is a place of refuge, but even here is no safe place from COVID-19.
Unfortunately, one of our trustees here is now on a ventilator in the hospital, struggling for his life.
Pastor Kelsey Steele says the virus is impacting the Dixwell community, and he's working with the mayor and governor to be a voice for the voiceless, pushing for more testing in communities of color. He says the Cornell Scott Hill Center's walk-up testing site next door is a major move for Dixwell residents.
This is very impactful to our community because we know that due to health disparities, African Americans don't have easy access to primary care physicians.
Racial data in New Haven remains incomplete, but the Department of Health is tracking hotspots in areas including Dixwell.
Most of our people in our community, they work in healthcare. They work in the grocery stores. They work as truck drivers. And so it's kind of hard to shelter in place when you are employed in these types of jobs.
Now a third testing site is on the way in the Dwight neighborhood.
It's crystal clear that they can't afford to be home, so they need to be healthy. We need to identify when they are sick, and we need to take care of them.
Dr. Stephen Murphy has set up several community test sites in Fairfield County. In New Haven, he says access to testing is badly needed.
And so being able to test, to treat, to isolate, and to trace those patients is going to be essential for the success of the health of these communities.
Here at Varick Memorial AME Zion Church, Pastor Steele tells us that he's been appointed to Governor Lamont's Faith Leader Advisory Council, where issues in the community are not just heard by Mayor Elicker, but they also go all the way up to Governor Lamont. In New Haven, I'm Kyle Jones, NBC Connecticut News.
Of you, we're waking up at God's hour. Woo! All right, listen, Avengers assemble, right? I got myself a little Hulk here, maybe. All right, Fernando, say hi to the medical students. Hello. Hi, guys. Welcome to early mornings. Time to load up. Good morning, everybody. We are here on the coast in Stamford, Connecticut, doing our drive-through testing here at Cummings Beach. Yes, it's raining out. It's miserable out. But we are here for you to test, treat, isolate, and trace. I finished my discussions with New Haven. We are going live next week. I'm very excited with that. I'm also excited to see that CVS is in New Haven doing a drive-through where they think they can test 750 people through 3 lines of traffic. That, in my mind, is an interesting model, okay? Because let me tell you what our model is, and I think that I'm excited about what CVS has to offer, but I also want to issue some caution. So when we test a patient, our medical students and doctors follow up with them. We follow up with them. Not just in day 1, not just in day 2, but we try and have regular communication with them because we know there can be false negatives. The false negative rate of the nucleic acid machines, the big ones, is around 2%. Because it's around 2%, we want to track and make sure that people who have symptoms, well, they get taken care of. So we've been very, very heavy on the medical care after the testing. Now CVS has minute clinics, and I actually am excited about it because you wonder if you're going to be able to get cared for by a minute clinic nurse practitioner when you test. So I don't know about that, but when I look at the registration form that CVS has, it looks like they're going to test adults. So another thing we test is we test children, but anyone under 18, they won't test. And they're using the Abbott machine. So that has a higher false negative rate. So I'm hopeful that they're going to provide the ongoing medical care, because that would be the right thing to do here with CVS. The problem I have with it is CVS owns Aetna, which is an insurance company. So CVS owns Aetna. CVS also owns something called a pharmacy benefits manager that pays pharmacies. So what they've done in the past is they starve the mom and pop pharmacies, and when they're ready to die, they just buy them up, right? So it's kind of a big monopoly that they have. So hopefully with the resources they've gained with that monopoly, they can do some medical care here to follow up the patients. So I'm excited about that. I'm also hopeful that they'll join us in serving the underserved, those who don't have insurance, those who are undocumented. And that's why our New Haven project is going to be pretty awesome. Currently, we are at about a 5% undocumented and uninsured patient list. Okay? Undocumented and uninsured patients. So we have a foundation that's helping support us with this, and that's very, very useful. And so hopefully CVS and its largesse will be able to take care of the underserved as well. So I'm very hopeful for that. And I'm looking forward to them as a partner with us in New Haven. Today, I also want to tell you about a project launched by Mayor Martin and the city of Stamford. We currently are testing municipal employees every 2 weeks. I just delivered the first results of those now, and those are very good results for all of the firefighters, police, and EMS personnel in the city that works, the city of Stamford. So I'm very happy to take care of all of the Stamfordians that way. Here we are in the rain today, my team with Dr. Fran and the local community MRC, the Medical Reserve Corps, have stood up for the weekends. So we'll be taking care of people today. We're off and running. I want to tell all of you a little bit about the immunology and the immunity testing, okay? Starting Monday, we will be doing blood draws for immunity testing at our site in Greenwich, Connecticut. That's our site in Greenwich, Connecticut. I'm hopeful that the mayor will see the benefit to this in Stamford, and we'll be able to do it in Stamford as well. And when I talk to the mayor of New Haven, I'm hopeful he will see it as a benefit as well. So we're prepared here to care for the patients who are COVID positive and to care for the patients who are not, and to keep everyone healthy and hospital free. Lastly, we have put in for something called a certificate of need to obtain CT scanners so we can care for the COVID patients, that we can identify if they're having co-infections with lung diseases or such that they have clots in their lungs and there's huge risks. So we have a lot of things that we're working on. We're very excited about this next level, being able to open up America again when it's safe. And so we're here to stand and make sure that we keep things safe, keep you healthy, okay? So we tell people, stay home, stay safe, all right? We'll be out here with coronatestct.com. That's coronatestct.com. Testing, treating, isolating, and tracing. Soon to be in New Haven, soon to be in Bridgeport, hopefully in Ridgefield soon, and then on up to Bloomfield, Linda. I saw you on there, don't forget, okay? We're working our darndest 24/7 to help you, all right? We're here to help the citizens of Connecticut, to test, to treat, to isolate, and to trace. All right, I hope you guys stay inside and stay warm today. We're going to get rained on, but don't worry, we've got the gear to protect us, okay? Stay home, stay safe, enjoy your families. This is Dr. Perez, and this is Dr. Ahmad Altahar, right? Yeah, that's good. And this is Jackie. Say hi, Jackie. Jackie's our nurse. All right. This blue area is the hot zone, okay? In the hot zone, you will find cones. You are to keep yourself away from the hot zone if you are not in the hot zone by at minimum 6 and ideally 14 feet, okay? That means down there, all right? That is away, right? So we cone this off for you. This is the hot zone. The people in the hot zone will wear visors. They will wear Tyvek suits. They will have N95s on. You will have N95s too. If you have not been fit tested, you need to contact us and we can help you fit test. All right, guys from the hot zone, wave, say bye to the students. Bye.
Hey, good afternoon. It is Sunday. We're starting another week. We want to get ready for that week. I want to thank everyone for tuning in. It's been a little while. I haven't been very good at keeping up with this because things are evolving in the field like crazy. So today I want to talk a little bit about immunity, about what I call corona care, which is the care for the patients that have COVID-19, right? The care for the patients that have the novel coronavirus, all right? What I want everyone to know is that it's not just a cold that you get through. A lot of things can happen with this virus, and so we're trying to identify things early. One of the first things that we do is we like to check blood work. Now, traditionally, patients with coronavirus have not been able to have blood work done. Why? You can't go to a Quest or a LabCorp to get it done. You'd have to go to a doctor's office, and most doctor's offices won't let patients that have coronavirus in the office. More on that in a little bit, because a lot of offices probably shouldn't be seeing patients at all if that's the risk. Or they'd send you to the hospital, and then in the hospital you have to get admitted to the hospital before they do a lot of blood work. And how do I know that? Because we have a ton of patients who went to the ER, went to the hospital, whatever that hospital was, and they got tested for coronavirus, whether in their drive-thru or whether in the ER, it came back positive, and the ER doctor discharged them and said, bye-bye, good luck finding a doctor. And like I said, doctors won't let you in the office if you have coronavirus. So where does a person with coronavirus get care? Here's where. coronatestct.com. That's coronatestct.com. We will take care of you. We have a bunch of medical students. We've got doctors, we've got nurse practitioners and PAs. They're all doing telemedicine visits for patients with coronavirus. Well, as we were doing these telemedicine visits, what we recognized is that patients needed more. They needed blood draws. They needed echocardiograms. There were some of them that were so weak and short of breath that we were worried they had myocarditis. And guess what we found out? They do. Or pericarditis, which is an inflammation around the lining of your heart. Some of them had really low oxygen saturations, and you know what we found? They had clots in their legs. So we need some blood work. We need an ultrasound. So we're doing corona care, and we're doing it in our Greenwich office on the outside in our courtyard. And we're working to get more corona care stations all over the Fairfield County, and we will work to get them in New Haven County too. So these are our coronacarect.com care stations, where we'll care for patients that have coronavirus, because that's the next step. So what's in this care at coronacarect.com? Simple. We're going to look at your blood work. This virus can cause kidney damage. It can cause kidney failure. So we look at your kidney function. This virus can cause you to be very inflamed, and so we look at your inflammation levels. This virus can cause you to have sticky platelets and what we call endothelial dysfunction, and create what we call microemboli, or clots, that end up in your lungs, that end up in your legs, that end up at the tips of your fingers and your toes. So we've got ultrasounds to look at your blood vessels. We've got lab work to look at your clotting factors. In addition to that, we prescribe medicines just like you would with any patient. And so we thin your blood if we need to. The only way we know is by testing your blood. And there's a whole bunch, thousands of coronavirus positive patients that aren't getting the care that they need. Why? because they're not sick enough for the emergency department, but they're sick enough to be cared for. And so we will answer that call at coronatestct.com, coronatestct.com, and the new website we're putting together called coronacarect.com, coronacarect.com. And that'll be up pretty soon. So that way you can book an appointment, be seen by one of our doctors, our nurse practitioners, or our PAs, and get the diagnostic workup that you need to get the right care that you need. Okay, so we talked about blood work. The next thing I want to talk about is antibodies, right? Antibodies come in 5 different flavors, right? We have IgA, IgG, IgM. So I could go through all of the different antibody types that are there. But the main ones that matter are called IgG and IgM. IgM happens in an acute infection, and these little pregnancy cards have an IgM on them. The problem with the pregnancy cards is that they are not very accurate. Linda, I'm trying to get to Bloomfield, but we've got 3 more sites that we're setting up this next week and a half. I promise when they call me, I will show them how to do it. I swear to God. So, as I was saying, the IgM on these pregnancy cards reacts to other coronaviruses. So, you could be infected. So when you pair an IgM from the pregnancy card with the Abbott machines, that's what was going on in South Korea, you improve that false negative rate. You lower the false negative rate. So a finger prick plus a swab equals a better result. It's still not as good as the Perkin-Elmer machines that are being run by Semaphore, that are being run by LabCorp or Quest. All right, so I want to shout out to Semaphore, which is a lab working with us, giving us 24-hour turnaround time. So I'm very happy with them. They're from Mount Sinai, my old stomping grounds. So we're very happy with what they're doing. Same with LabCorp and with Quest as they improve their rate here. And I think they're going to help us quite a bit in New Haven. So the pregnancy cards have an IgM. That means acute infection. They also have an IgG. Now that means that it comes later in the infection, although some of the new studies show that it comes in when you have 4 or 5 days of infection. So it's kind of interesting to see those levels and how they interact in different people genetically. So those are the pregnancy cards. Those are not the best because there's no CPT code for them. Who knows what's going to get paid for them? So then there's the next test, and that's the serology blood test. We are doing blood draws. Why? Because we're already testing for other blood work. So we're going to test your IgG levels. IgG levels, remember what I said, come in later in the infection or when you have quote-unquote immunity. So we're going to check our novel coronavirus positive patients for their IgG levels. In addition, if you think you had coronavirus, we'll check your IgG levels too. At the same time, we're going to check your nose, right? So we'll swab your nose and we'll draw your blood work too. No problem, easy peasy. And we're doing this in our Greenwich office on Monday. We almost have a couple hundred people that have been signed up to start with our coronacarect.com, right? coronacarect.com care modules where we care for you. Now, because a lot of the stuff is telemedicine, we can do this anywhere in the state. We can send for lab requisitions other places that will let your blood get drawn. We can care for you anywhere in the state. And it's not just Connecticut. We can care for you in New York. In addition to caring for you in New York and Connecticut, we are working to get an interstate compact license where we can do telemedicine for you in other states. Why? We've been in the hot zone. We have the expertise, and we can care for you. We can help you wherever you are, because we know a lot of medical practices have shut down. They have closed because they don't want coronavirus in their offices. And that's okay. They're protecting their staff, and I totally understand that. But it doesn't change the fact you still need care. So we are here to give you that care. coronatestct.com, through my practice, Murphy Medical Associates, and our new website coming up called coronacarect.com. We'll care for all of those in the tri-state area. Just go to our website. You can register. We'll take care of you. You can set up telemedicine visits. You can set up blood draws. You can set up ultrasounds, and we will give you the care that you need. I'm hopeful that the state approves our waiver and we can get a CT scanner to discover patients who have clots in their lungs. This is what kills a lot of outpatient coronavirus positive patients. They end up with clots in their lungs. And so if we can screen for that, whether it's through an ultrasound of the legs or an ultrasound of your heart to look for strain or a CT scan of your lungs, we can save your life. That's what we're here for. Okay, that's what we're here for, to be the early warning sign at coronatestct.com and soon to be coronacarect.com. We're going to care for you. Test, treat. We are here to treat you. Test, treat, isolate, and trace. Again, the new updates are that we are going to be able to deliver care in our Greenwich offices to care for you, to test for your antibodies. There's multiple antibodies. To test for chemicals in your body that indicate you're not going to do well with this condition, and to give you the care that you need to keep you healthy and hospital free. All right, I want to thank all of you for the update today. We're going to go live in New Haven soon. We're going to meet with a couple of different smaller towns in Fairfield County to set up their drive-thrus. We're very excited for our next steps. 2 counties, Linda, will move to Hartford as soon as we can. New Haven County and Fairfield County. We will move to Hartford as soon as we can. I'm going to ask any other doctors out there in Hartford County, if you want to set up these drive-thrus, we can help you at coronatestct.com. That's coronatestct.com. We love you guys. Have a great Sunday. My team has a good big Zoom meeting tonight, so we're going to go over a lot of the plans. All right, I wish you guys all well. I hope you had a great weekend. Remember, antibodies are multiple. IgG and IgM are the most important ones. IgM is for an acute infection. IgG is for longer-term immunity. Once we can find out who's had the virus and who's immune from the virus, we can begin to start society again. We'll get there together at coronatestct.com. That's coronatestct.com. This is Dr. Murphy signing off. Bye-bye, guys. Good evening, guys. I wanted to reach out to you. I had a couple of meetings today with some of our future sites, and they went really well. In addition, I wanted to touch base with you because a couple of people have asked me, hi, Linda, how are you doing? A couple of people have asked me why I'm not a big fan of the Abbott ID Now machine. Why am I not a big fan? It's a nucleic acid test, which I think is the right type of test to identify in your nose. It's very reasonable for that. But here's why the Abbott Now is the low man on the totem pole for the nucleic acid tests. In the head-to-head test, ID Now, the Abbott machine, the Cepheid Express machine, and a high-end Roche thermocycler, like the best research machine out there. The ability to detect, influenza A in a head-to-head analysis had the following percentages. 93% with the ID Now machine, 100% with the Cepheid machine, 100% with the Roche machine and the Cobas machines. The ID Now was 7% less accurate. 7% less accurate. And that's a big problem if you're going to mass test everyone. Now, I'm happy that CVS is out there testing. I think it's the right thing to do. But they have to get a different machine. All right. Dr. Murphy signing off, Murphy Medical Associates and coronatestct.com. It's coronatestct.com. Have a great night. Thanks. Good afternoon, everyone. Good afternoon. I want to give you a quick coronatestct.com update right before the governor's press conference. Right before the governor's press conference, I want to give a quick coronatestct.com update. First, I want to let you know that the state has denied our application. Hey, Linda. So the state has denied our application for a certificate of need waiver. I want to explain what a certificate of need is. So a certificate of need actually doesn't exist in many, many states and has actually been argued to create monopolistic practices. But in certain states, there's a health strategy that comes about where the state wants to make sure that patients can get the services that are needed while at the same time not getting over-serviced. You know, the governor did a list of this a while ago, and they found that there were too many hospitals in the state of Connecticut. But they didn't start canceling hospitals, and right now I bet you the state is glad that they didn't, right? So the problem with the certificate of need process is when you apply for these things, you actually don't talk to other doctors. You have to present your case to lawyers, right? I had to go to lawyers and talk to them about why I needed a CT scanner. It's just a crazy process. But in Connecticut, that's the process, so we went through it. We were denied that process. We were denied our waiver to be able to scan patients that had coronavirus positive disease. And what would we scan them for? Well, we want to make sure that they don't have clots in their lungs. We want to make sure that they don't have long-term complications of this infection. And we want to make sure that we can identify people that have coexisting pneumonias from this infection, something that a CT scanner is really good at. Unfortunately, at coronatestct.com, we won't be doing that because we weren't awarded the waiver. But I will tell you that the Radiologic Society of Connecticut wrote an opposition to our application. I know we are, and we're trying our best, Linda. I appreciate it. They wrote an opposition which basically said we are self-referring pirates, which we really are not. There are lots of organizations, like health organizations, Yale. They employ doctors who then order CT scans. Hartford Health employs doctors that order CT scans. Nuvance Health employs doctors that order CT scans. So this was a turf battle, and I learned a lot about how people are reacting here. Now, radiologists, their volume's way down, and so their business is way down. And so if anyone would be doing COVID scans, I would expect it would be those radiologists to put together an outpatient scanner that would be a dirty scanner, right? A scanner for patients who are infected with coronavirus, especially to detect the pulmonary emboli. You know, the Hour put an article out that was from the Washington Post, which showed that patients that have novel coronavirus are exquisitely at risk of pulmonary emboli and what we call microemboli. And this is what's killing a lot of those patients. Unfortunately, if you want one of those scans, you will not be able to get it on an outpatient setting in the county, in Fairfield County. You're not going to get it. This is where our application was, and we were trying to give that service when we presented our need to a team of lawyers. Now, listen, there are a lot of things lawyers are great at. Understanding the nuances of healthcare, maybe not so much. That being said, they're great at legal arguments. And so in order to get this certificate of need, you needed a lawyer to argue the case. Unfortunately, I'm not a lawyer. We lost. And therefore, we're going to continue to look. And in fact, we're going to implore all of the outpatient radiology centers. Man up. Do the right job. Do the right thing. Get yourself a dirty scanner to scan these coronavirus, these COVID positive patients. You're not scanning them. We know who you are. We're not going to mention names, but it's unacceptable. These patients are underserved. We have to care for them. The state has taken away my ability to care for them with the CT scanners. So now it's up to you, right? We're talking to all the healthcare organizations, including the teams like the ones at Advanced Radiology who are not scanning coronavirus positive patients. You have to scan coronavirus positive patients. It's how we're going to save their life. All right, so the mayor is coming on in a few minutes. I hope everyone tunes in. The governor's coming on in a few minutes. I hope that everyone tunes in the state of Connecticut. This is Dr. Murphy with coronatestct.com. That's coronatestct.com. Wishing all of you a wonderful, wonderful, wonderful afternoon this Wednesday. Get outside, get some sun. It's good for you, okay? Get some sun, get some fresh air. This is maintain social distancing. This is Dr. Murphy, Murphy Medical Associates, and coronatestct.com, signing off after my little update. Okay, thank you guys. Take care. Bye. Good evening, everybody. Good evening. It's getting kind of late out. It's 9 o'clock at night on the 23rd, I think the 23rd of April. You know, I had traditionally been using these coronatestct.com periscopes to let people know kind of what we're doing and where we're going. Tonight I want to talk about the future, right? I want to talk a little bit about the future and kind of at what I see with the future, right? So we've got a highly contagious virus that is deadly in about 1% of cases. And in about 10% of people, it makes people really sick and end up in the hospital all at once. And so the strategy of quarantine is to slow down that amount of people sick all at once. And that's what we call flattening the curve, right? The flattening the curve doesn't mean we're going to eradicate the virus. It just means that this virus is not going to create such surges in hospitals that that a lot of people die from lack of resources in hospitals. And I would say as a whole, Connecticut's done a good job with that. And I think the governor played a huge role. I wish schools probably would have closed a little bit sooner. And I also wish that I didn't have to homeschool my kids and teach my kids, but that's part of the deal. And, I'm doing my job and my part in helping our kids here. But yeah, that's real. That had to happen. It probably could have been sooner. In addition, a couple of other different businesses with really close quarters probably could have been closed sooner too, but no one's here to Monday morning quarterback. I'm here to say how great a job the governor did. I think he did a great job with what he had and what we had and what we did know and what we didn't know. So here's what we didn't know. We didn't know how infectious this virus was. We got data from China and we got data from Korea, but we really didn't know. We didn't really know how easy it was to spread. We didn't know the social distancing feet apart based on studies and modeling. We didn't recognize that buses and subways were really bad places to be. We also didn't recognize how underserved communities and essential workers were really exposed to these viruses and brought them home to their families. We also didn't know what a dangerous place and these nursing homes had become. And there's a lot of reasons for that. I'm not going to Monday morning quarterback them, but I think part of it is medical leadership in the different hospitals and in the different nursing homes. It's really tough to Monday morning quarterback this because we've had 3 successive scares that didn't pan out. So if you're a pragmatist, you blow off the 4th scare, right? The 4th scare here, I think, is this novel coronavirus. Right before that, we had Ebola that should have served as a warning to talk about these things. And I think people got tone deaf with the next quote-unquote epidemic. Well, here we are. This is a real pandemic. There's no doubt about it. And I think we take for granted our immune systems and the ability to handle infections, and the ability to not over-respond to infections. So we didn't really understand a lot of that. In addition to that, we still don't understand fully the physiology of this virus and how it interacts in our body. We still don't understand that. So it's really tough to treat a disease when you don't know exactly what the disease is. You don't know exactly what the virus is doing, and you don't know exactly what our body is doing to fight the virus. And so what we do at Murphy Medical Associates is we apply the best literature we have. We review the new science coming out, and we voraciously read Twitter. Yes, Twitter. There are a lot of really smart doctors and a lot of really great institutions, and even not great institutions, that are producing really quality, eminence-based advice. They're giving lectures, and it's fantastic. And it's not just our big systems like Mount Sinai or Columbia or Mass General or the Mayo Clinic. It's also places like Elmhurst, Queens. It's also places like SUNY Downstate. It is at places even out west, out east, in the middle of the country. Everyone is playing a role in giving advice and measuring data here. And so as a doctor, we have to watch the data. Okay, so we're doing that. So in watching all of that stuff, one of the good things that I've been gifted with is a vision of where we're going in the future. And the president laid out some of these phase 1, phase 2, phase 3s. I want to go past phase 3 and I want to go to phase 5 or 6. It's not going to be the same. All ventilation systems are going to have HEPA filters in them. I believe that there's going to be a whole industry of making sure that buildings are virus-proof, or that a virus can't spread. You know, I would tell patients that there was a study that was done that they found in under 2 hours, the influenza virus spread from the front door of a 100,000 square foot building to all the way to the back bathrooms. There's going to be a whole industry for bug-proofing buildings and making them healthy buildings, keeping them safe and away from viruses. I think part of it's going to include lots of UV sunlight. I think it's going to include HEPA filters. I think it's probably kick plates and automatic doors, where people don't have to push buttons, turn handles, or put their hands on anything. I think a lot of that stuff is going to be automated and fixed. I think people are going to really recognize that schools are a gumbo of bacteria and viruses, and so we have to be careful with them, and we have to know which bugs are not going to kill. And it's really tough to do that. And so I think there's going to be some enhanced immunosurveillance at schools. I think that'll be very much the case, very similar to how in colleges they make you all get the meningitis vaccine now, because meningitis is a killer. And so we protect with that. I think medical practices as a whole are totally going to change. I think the stopping in the office for a sniffle is probably not going to be where people go anymore for medicine. I think there's going to be a lot of telemedicine for that, and I think there's going to be mail-in kits. All right, I'm back. Sorry. That was one of the labs we're working with, Semaphore. They're a great lab, by the way. They called me with positives for the day. So it was a really useful call. We're using that lab to help screen municipal workers, and they're doing a really, really, really good job. Hi, guys. How you doing? Welcome to my podcast. My Periscope, I guess, is what it is. I got cut off before where I was talking about the future. Woo, the future. Right, and I was talking about what's going to happen next and where I see things going in the future. Because usually what I do is I talk about our sites, and then Linda gets on and she asks me when I'm going to Bloomfield. And I tell her, listen, the Hartford Department of Health has to reach out to me. And we go through that a little bit. And I wanted to talk a little bit about the future, because as we're kind of settling into our long-term sites, we're finalizing some details with Bridgeport. We're hammering things out. NBCCT interviewed me today, where we talked a little bit about our plans in New Haven and just finalizing those. The mayor had a press conference today. There's still more kinks that have to be worked out, but they should be okay. So we're back to what I'm talking about, which is the future and where I see it. We'll see each other, Linda, I guarantee it. So the future of medicine, as I said, sniffles and colds and those things, we're now understanding. Most of them we have some sort of immune system to, or our body doesn't overreact. The problem is this virus is not like those. So I think a couple things we learned is the following. Having a patient with upper respiratory or GI complaints come into your medical office without you having PPE on, or without them being protected is a recipe to infect your entire office. So I think medical offices are not going to do a lot of sick visits. I think sick visits are going to be telemedicine, unless you're really sick. And then you're going to go to a diagnostic place. You go and get blood work done, and they won't want you if you're sick either. So where are you going to go for those? I think these are going to be like care pods. These will be sanitary, safe, and healthy exam rooms that are private rooms that can be easily sanitized, probably UV lit, and if someone's really smart, they'd create them out of like maybe railroad cars or something. And I know Neil, I think Nuvance bought him, right? I think Nuvance finally bought Neil, so he's going to be part of Nuvance now, which, by the way, listen, Nuvance is a great team. They are open-minded. Like I said, they brought me in and asked me what I was doing with drive-thrus. I gave them my playbook. They did a great job with it. I met with the lead neurosurgeon at Danbury Hospital, who's also a Nuvance guy, and we had a good talk at one of our drive-thrus. They're planning something in Ridgefield, and we debated the Abbott machine, which, guess what, is not that good, right? So just because it's a fast test doesn't mean it's the best test. And I can tell you right now, they did a head-to-head with the Abbott and the other molecular machines, and the Abbott was left wanting, right? It was. I'm sorry. It was probably the worst performer out of all of the molecular machines that they had. Still not as bad as the ELISA cards for DNA, but it's pretty bad. Anyways, back to the future. So I think the future of medical care is going to be this transition. Even in urgent cares, I don't think you're going to have upper respiratory people or people that could have COVID in the offices. And if you do, people are going to be in Tyvek suits. And so I think that they're going to have open air care. Open air care. Tents or railroad cars, maybe. I think they'll probably be sanitized. You'll probably put a ring of sanitizing spray that can go into these railroad cars, poof, and get rid of whatever virus is in there. And then you bring the next patient in. And I think that's probably what is going to happen. I think that's where the future of sick care goes that doesn't end up in the hospital. I think regular offices are going to be for healthy people. But I've got some news for you. We're finding a significant percentage of asymptomatic carriers, no symptoms with COVID, and they're walking around with it. And so I think there's going to be a role to play in the gene host, gene bug environment, right? And I think whoever can get down to the understanding of how our body responds to infections it's a big win. It's a big win. It's a whole area of what we do at our practice called personalized medicine, right? Tailoring genes and drugs, tailoring family history and cancer screening or heart disease screening. We've always been at the forefront with that in our practices. And that's because, again, we kill it on the data and the literature. We are very, very diligent with our literature and our science. But we also understand the basic science. And so we can recognize when something is going to be there quicker. Oh, I'm going to tell you, Linda, here's how they're going to test everyone. Currently, we are working on validating saliva tests. That's right. Coronavirus is in your saliva. So if you drool in a little sample kit, we can detect the DNA from there. Guess what? We can mail out those kits nationwide. Mail a kit with a FedEx, drool, pop it in, send it out. Here's the catch. It has to be stabilized with a specific solution. If it's not stabilized, then you can't transport it at room temperature. So it's very important that these stabilized solutions don't run out like our quote-unquote UTM runs out. And so there are a couple of companies that make this. One of these is in Canada. They do a great job with it, but they better prepare because these saliva tests are how we're going to screen the entire nation. The future is also going to include a mandatory database, I believe, of de-identified reporting. So you're going to be able to see the hot spots and the hot zones and stay out of those towns. And I think that's going to happen. So that's real. In addition, identified reporting is going to happen at the local departments of public health. The Department of Public Health nurses have done great jobs in all of these towns. I just spoke to Department of Public Health in Greenwich. I couldn't have been more pleased by them. And so I think there's going to be a lot more collaboration between community doctors and their public health departments. I think we're going to see a lot more of that. So I think that's part of the future of medicine. In terms of elective surgeries, man, I think people are probably going to have to get COVID tested, and maybe not once, but twice before they go through elective surgery in most places, because they're just not prepared to clean the ORs, to sterilize the equipment as much as is really needed to prevent this really sticky virus. And again, I think UV light's going to play a big role here. So I think that's the future of that sort of stuff. Waiting rooms. I think waiting rooms are a thing of the past. In fact, I believe what will happen is very similar to Disney's Fast Passes, right? You get a good thing that reminds me of is like the Rise of the Resistance. You get a window, and you have to show up in that window, and there will be a room for you. You won't wait around. You're going to be like, oh, you're part of this window? Boom. You're going to go in this room. So I think what's going to happen is waiting rooms are going to get removed, and people are going to wait in rooms. No one's going to be in a big bullpen anymore. The bullpens are gone. I think you're going to have little isolated pod rooms, like telephone rooms, where people will wait. Here's the problem. How do you ventilate them? So it's going to change HVAC forever. I think HVAC is going to be changed forever. And the person that works on HEPA filtration and works on those systems, it's going to be everywhere. And if you're in a building, no one's going to be waiting in common areas. It's just not going to happen. It's going to be very isolated pods. I think that's where medicine is going. Let's talk about baseball, right? Let's talk about sports. Are sports just going to be watched on TV? I can tell you right now, I've watched a football game, pro football game in the stadium. I've watched a college game in the stadium. I've watched a pro game on TV. I've watched a college game on TV. On cold days, I'd rather be on my couch. On great days, I'd rather be at the stadium tailgating. But when I get into the pro stadium, it's not as enjoyable. A college game is enjoyable. Schools are next. I'll be up to schools. I think I talked a little bit about it. But I think sports are going to be radically changed. I think how we watch sports will be radically changed. I think how we interface with each other, until we really know where immunity is at, whether we'll get a vaccine or not, I don't know. But until we know where immunity is at, I think that tailgating's changed forever. I think it's going to be these, probably you'll pull up in your camper and you're not going to change or exchange with other campers. Maybe there's someone out there in a Tyvek suit or whatever going from camper to camper, and you've got some video channels you can watch on it. Going in the stadium and watching these sorts of things, I think it's going to be very drastically different. I can tell you right now, probably everyone's going to have an N95 mask. That's going to make shouting and screaming really tough, but that may be what happens. That may be what happens. Who knows? But I think the future of sports is radically changed. Radically changed. I think that there will be a lot more in detail video monitoring and maybe even some cameras on the players to get better angles and stuff like that. So that way there's a more immersive 3D vision. So the at-home audio video buffs will appreciate that. So that's sports. So I did sports. I did medicine. Most business. I mean, I think everyone has just recognized that a lot of the business can be done at home. So I think people will have work offices. I think they'll take tax benefits from that. I think that'll make sense. In addition, I think that commercial real estate is toast. I'm sorry if you're a commercial real estate investor. I think you're dead. I don't think that unless you can make your building bug-free, no one's going to want to rent from you. And especially in New York City with sky-high property taxes, sky-high rents. I think New York is going to take a big hit. I think big cities are going to take a big hit, especially with commercial property. I think that's going to be a big problem. We'll start next with schools, because Linda asked about schools. I think in schools you're going to have IR thermometer monitoring, right? Then you'd have an IR camera as the kids walk in, so you're going to check their temperatures. I think there's going to be nasopharyngeal swabbing in the schools. I think that the public health nurses and the public school nurses, hey, guess what? In Darien, they all know how to swab now, because they are working our drive-thru in Darien at coronatestct.com. So I think that you're going to have machines, the molecular machines, CLIA waived ones, probably by BioFire Diagnostic, where the nurse is going to swab the kid and run and find out whether they got coronavirus right there in that time, 40 minutes, 45 minutes maximum. And that's going to happen in schools. In addition, school spacing is going to be much further apart. There are some schools, like down in Philadelphia, they're going to make you wear N95 masks the entire time. Now, when you wear an N95 mask, it's not really designed for you to wear it all day. So I'm wondering if people are going to have particle lung from wearing those masks. I know when I wear them all day long, I'm like recirculating a little bit of the carbon dioxide. And that can affect me in the mind. And so with school, I wonder if they're going to have issues with that too. But I think that's the way school's going to go. I think we're going to have rapid molecular testing in the schools. I think you're going to have IR cameras in there. I think you may have hall monitors for a little bit of social distancing until we really know where immunity is at. So I think it'll change a lot of school after school activities. Sports and those things are going to be radically changed. I haven't begun to contemplate after school sports. It may be more independent sporting events, things where you're not in close congregation with each other, that sort of thing. And we'll see. Food and eating. I tell you what, I don't get takeout. I know it's in saliva. I don't know that it cannot be fecal oral. I think it probably won't be, but I think it could be, and that means passing from stool to mouth, right? So you can get in the GI tract. There have been so many GI problems with patients, at least 40, maybe 30 to 40% of patients had GI complaints alone. So that says to me that it probably could be spread orally. The research on it is not really there, but oh yeah, totally. School buses, huge concern. Huge concern. School buses, like the same thing. I think this changes forever. I don't think there's going to be school buses. I think that there may be isolated taxi services, and this goes back to automated cars, right? If you have an automated car, it's not an infected car. You don't have other people in the car. And so, if you can do the automated car thing, I think it's a little bit safer. And I think we'll see that, the little small cars. You get in the car, it'll drive you to school, drop you off, get you back when you're ready to go, probably track you on your phone. So I think another thing is going to be a problem is kids have been on the phones way too much. So I think we're going to see a lot more of that zombie brain stuff with kids. I've worked really hard to keep the kids off electronics, but I think that's there. I think that's there to stay. I think we're going to have more electronics. Foods and eating. I think the rise of the garden again. They've had outbreaks at meat processing plants, and that's because the people that work in the plants are very close to each other. Trust me, if the meat processing plants could figure out how to have machines cut the meat as effective as humans do, they would have done it already. I think we may see more issues with good cuts of steak, that prices may go up because they're going to space people out pretty significantly, and we may see more ground beef than anything else. In terms of produce, I think we have to be I don't know about the 5G thing. I honestly haven't seen any data on it, so I can't even conjecture 5G related or not at all, other than that there's obesity, and the obesity increases the risk of having bad outcomes with coronavirus, and it also reduces your immune system. It's a very tough thing. Predominantly, again, underserved populations really were racked with obesity, so it's an issue. So I think this is my first wave on the future of where things are going to go. I'll do a couple more of these as we go along. We're getting ready on our sites in New Haven. We're getting ready to interface with the Ridgefield team. We're doing great with our Dyin team. I think we've got some other strategies for them, including a process I call coronacarect.com. That's to manage patients who have coronavirus long term. We really have developed an expert team and an expert system to manage coronavirus patients. So that's at coronacarect.com if you want to check it out. This is Dr. Murphy with Murphy Medical Associates and coronatestct.com. That's coronatestct.com, where you can sign up for corona tests, including checking your IgG for immunity. All right. Hope you guys have a great night. We'll talk to you soon.
Families visiting loved ones at Jewish Senior Services in Bridgeport, Connecticut have to meet in a tent. Last spring, when COVID first hit, CEO Andrew Banoff says they were much less prepared. 22 residents died.
I cried myself to sleep at night, recognizing that we didn't have the tools to care for people that we are here to serve and care for. So it was very difficult.
What were you lacking then?
Most importantly, it was knowledge.
They lost 2 residents last Friday.
So in many ways, it's exactly the same. We still have the fear, we still have the uncertainty, we still don't have a vaccine.
With more than 20 staff infected now, nurses who are well are covering. Nursing homes across the country are still reporting shortages. A review of federal data by NBC News shows 1 in 10 facilities said they did not have a week's supply of N95 masks. Nearly a third of all nursing homes said they had to wait 3 to 7 days to receive COVID-19 test results.
We still lack rapid turnaround testing in most U.S. nursing homes. That needs to change.
More than 1,300 nursing homes across the country had 3 or more COVID cases, the highest number ever reported in a single week. Midwestern states are particularly hard hit. In Iowa alone, there are 3 or more cases in 56 facilities.
We are in the middle of it here at Friendship Haven.
2 hours from Des Moines, in the small city of Fort Dodge, CEO Julie Thorson is angry and frustrated people are not wearing masks. Community spread, fueling more cases than they've ever seen.
I actually have people say, well, if your employees wouldn't bring it in, we're not the villains. We're not the ones that, aren't doing what we're supposed to do. The community needs to step up now.
It's why she and her staff keep posting pleas.
So from us to you,
to protect the most vulnerable. Kate Snow, NBC News, Bridgeport, Connecticut.
Tonight, with the rate of infection increasing in cities across America, there are alarming new statistics showing the pandemic is taking an especially heavy toll on minority communities. In Illinois alone, more than 40% of those who have died are African Americans, even though only 15% of the population is Black. Adriana Diaz has more on these disturbing disparities.
Today, Anthony Smith of Detroit was remembered, the first known mail handler to die from the virus. His co-worker, Brittany Crumpton.
I don't want to go back to work because I'm have anxiety about it really bad.
Another public worker, Detroit bus driver Jason Hargrove, succumbed to the virus days after complaining about a woman coughing openly on his bus.
Man, y'all need to take this serious. It's folks dying.
Their cases are part of a grim trend. African Americans account for 41% of COVID deaths in Michigan, though only 14% of residents. In Chicago, Black residents represent 72% of deaths, but just 30% of the population.